Have you ever wondered why an itch that seems harmless could actually be your body's warning bell? Many people assume itching is simply caused by dry skin or weather changes, but for older adults, it could signal something far more serious. One day you might feel a tingling itch and think it's just due to dry air. But if, after a few weeks, the itch spreads and comes with mild pain or numbness, see a doctor immediately. This could be a warning sign of a serious health condition. The truth is, many older adults ignore persistent itching in areas like the legs, back, scalp, hands, or abdomen, not realizing it could be linked to conditions such as kidney or liver disease, diabetes, or even skin cancer. These small symptoms, if identified early, could save your life or that of a loved one. This video will help you explore 5 common itchy areas in seniors and why you should never dismiss them. You'll gain a clearer understanding of which symptoms warrant medical attention, how to care for your skin, and how to improve your health from the inside out. If you find this topic helpful, please hit like and share it with your older loved ones. This small gesture could make a huge difference. Have you ever experienced prolonged itching in a certain area? Leave a comment to share your experience or ask a question. I read them all and will respond in upcoming videos. Now let's begin this journey of discovering your body so you can better understand what it's trying to tell you each day. When it comes to itching in older adults, we can't overlook the lower legs and feet, areas that constantly bear the body's weight and serve as our first point of contact with the ground each day. But it's not just about fatigue or dry skin. Itching in these areas can be an internal signal that many often ignore. Have you ever felt itchy legs at night that kept you tossing and turning? Or a tingling sensation, like ants crawling, that recurs every time you walk for a long time? If so, it might be more than just a skin issue. The lower legs and feet are particularly vulnerable to 2 common health concerns among seniors: poor circulation and nerve damage caused by diabetes. Peripheral artery disease, a condition where narrowed or blocked arteries from plaque buildup reduce blood flow to the legs, can lead to dry, fragile skin, itching, and even ulcers. Meanwhile, diabetes can result in peripheral neuropathy, causing symptoms like itching, numbness, and burning sensations, especially in the feet. What's more, the skin on the legs is often overlooked in daily care. Wearing tight shoes, poor hygiene, or a lack of moisturizer can make the skin dry and more prone to irritation. As the immune system weakens with age, even small cracks can become gateways for infection, worsening the itch and leading to more serious issues. The good news is that with proper detection and care, most causes of leg itching can be managed effectively. Maintaining good blood circulation and proper skin care can greatly improve the quality of life and reduce the risk of serious complications. First, ensure regular medical checkups, especially if you live with diabetes or high blood pressure. Vascular screenings and peripheral nerve tests can help catch early warning signs. Second, gentle exercises like walking, stationary biking, or yoga not only boost circulation but also keep joints flexible, relieving heaviness and discomfort. Third, wearing medical compression socks can help blood return to the heart more efficiently, especially for those with leg swelling or varicose veins. And lastly, don't forget to moisturize your feet daily, especially after bathing. Creams containing urea or ceramide help restore the skin's protective barrier and effectively reduce dryness and itching. Avoid vigorous scratching or soaking your feet in hot water for too long. These habits can do more harm than good. Itchy legs are not a normal part of aging. They are gentle reminders from your body that you deserve better care, even in the smallest things. Paying attention to your feet each day is one of the best ways to protect your entire body and preserve your independence. So what if the itching appears around the nape of your neck, the very spot that connects your brain to the rest of your body? Let's keep exploring to understand why you shouldn't ignore the signals coming from this vital area. Have you ever felt an itch at the nape of your neck after sitting at your desk for too long or waking up from an uncomfortable sleeping position? What seems like a simple irritation might actually be a sign of deeper health issues, especially for older adults. This is something that deserves closer attention. The nape of the neck is an especially sensitive area. It's not just where the head meets the body, but also a hub for major nerves and motor functions. Persistent itching in this area is often more than just a surface skin issue. It can be linked to underlying conditions such as cervical spine degeneration, herniated cervical discs, or nerve root compression, all of which are common in older adults. When the cervical spine begins to degenerate, the vertebrae may press on nerves that run from the neck down through the shoulders and arms, causing tingling, itchiness, sometimes accompanied by numbness, pain, or stiffness. Additionally, poor posture, especially when spending long hours using a computer or smartphone, can strain the neck muscles and restrict blood and nerve flow, leading to uncomfortable itching sensations. In some cases, skin conditions like eczema, psoriasis, or allergic reactions to fabrics or shampoos can irritate the neck. However, if the itching is accompanied by pain, joint stiffness, or radiates to the shoulder blades, it's time to consider deeper internal causes. The first step is to correct your daily posture, especially if you spend a lot of time in front of screens. Keep your head and neck aligned, avoiding long periods of tilting forward or leaning back. Use a neck support pillow when sleeping and ensure your mattress is neither too soft nor too firm. Gentle exercises like neck rotations and shoulder stretches can improve circulation and relieve pressure on the cervical spine. Also, make it a habit to moisturize your neck after showering and avoid products with strong fragrances if you have sensitive skin. Additionally, pay attention to warning signs. If neck itching is accompanied by radiating pain, numbness, or weakness in the arms, consult a spine or neurology specialist right away. An MRI or cervical spine X-ray can help pinpoint the cause and guide appropriate treatment. Itching at the nape should not be overlooked. It may be your body's way of telling you that your spine needs care, and the earlier it's identified, the better your chances of restoring mobility, relieving discomfort, and maintaining a high quality of independent living. Keeping your neck flexible and healthy is the key to preserving the connection between your mind and your body, and sometimes it all starts with the smallest adjustment in your posture today. Itching on the chest and upper torso is not uncommon among older adults, yet it is often overlooked or mistaken for minor skin irritation. However, this can actually be one of the most concerning areas of itch because it's closely connected to vital internal organs such as the heart, liver, and kidneys. First, let's look at the bigger picture. Chest itching may originate from poor blood circulation, especially if the cardiovascular system is underperforming. When the heart fails to pump blood effectively, the delivery of oxygen and nutrients to the skin slows down, causing the skin to dry out, become irritated, and eventually itch. This condition is often accompanied by fatigue, shortness of breath during exertion, or mild swelling in the limbs. In addition, the liver and kidneys, your body's main detox organs, play critical roles. When these organs start to fail, toxins accumulate in the body, and one of the ways the body reacts is by triggering itchiness, sometimes throughout the body, but often concentrated in the upper torso. In cases of liver-related itching, patients may also notice mild jaundice, dark-colored urine, or persistent fatigue without a clear cause. With kidney dysfunction, the itch tends to be more persistent and intensifies at night, often disrupting sleep. Another factor to consider is allergic reactions, ranging from food and medications to fabric materials or detergents. The chest is an area in constant contact with clothing, and if the body reacts to synthetic fibers, dyes, or chemical softeners, itching can easily occur. What's particularly dangerous is that a chest itch can sometimes be the only early symptom of a serious condition. If you merely apply creams or scratch the area for temporary relief without identifying the root cause, you may miss a critical window for treatment. That's why it's essential to listen to your body holistically. If the itching is accompanied by signs like shortness of breath, chest tightness, irregular heartbeat, or unexplained skin blotches, seek medical attention promptly to assess your heart, liver, and kidney function. Routine blood tests, ECGs, and abdominal ultrasounds can reveal valuable insights into your overall health. In the meantime, adopt lifestyle habits that protect both your upper torso and your internal organs. Limit foods high in salt, sugar, and saturated fats. Increase your intake of leafy greens, omega-3 rich fish, and stay well hydrated to support liver and kidney efficiency. When taking medication, especially new prescriptions, always read the label for potential side effects involving skin or itching, and inform your doctor if anything seems unusual. Lastly, remember this. Itching is never something to ignore, especially when it shows up in the center of your body. It might just be your heart, your liver, or your kidneys whispering that they need a little more care. Have you ever felt an itch in your hands or wrists while typing, holding a spoon, or even just resting? That seemingly harmless sensation may be an early sign of deeper issues within the body, and if you're approaching or already in retirement age, it's something you shouldn't ignore. The hands and wrists are among the most frequently used parts of the body. They're constantly in motion and exposed to changes in temperature, humidity, chemicals, and friction. This makes the skin in these areas more vulnerable to dryness and irritation, but it also means that unusual symptoms can easily be mistaken for normal fatigue. However, when itching persists, especially if accompanied by numbness, mild pain, or muscle weakness, it may be a signal from your nervous and musculoskeletal systems. Itching in the hands and wrists is often associated with joint inflammation, particularly osteoarthritis, which is common among older adults. When the small joints in the wrist become inflamed, changes in joint fluid and increased friction can irritate surrounding nerves. One of the earliest reactions is itching. Carpal tunnel syndrome, which involves compression of the median nerve passing through the wrist, also causes similar symptoms: tingling, numbness, and weakness, especially at night or after prolonged hand use. Nutritional deficiencies, especially in omega-3 fatty acids, vitamin E, or zinc, can also impair the skin's protective barrier and affect peripheral nerve function, making the skin drier and more sensitive. A diet low in healthy fats or long-term medication use may weaken the skin on the hands, which naturally has fewer oil glands than other parts of the body. To manage itching effectively, start by reassessing your daily habits. Protect your hands with gloves when doing housework, especially when handling dishwashing liquid, detergents, or other cleaners. Moisturize regularly after washing your hands using creams that contain emollients like glycerin or almond oil. If your hands are cracked or flaky, avoid harsh soaps or hot water. Instead, opt for mild, fragrance-free cleansers. Also, pay attention to warning signs. If itching is accompanied by sharp pain, muscle weakness when gripping, or a shock-like sensation when extending the wrist, it may be a sign of carpal tunnel syndrome and should be evaluated by a neurologist. Early treatment with wrist splints, physical therapy, or changes in work habits can prevent serious complications like muscle atrophy or loss of hand function. Nutrition plays an equally vital role. Increase your intake of fatty fish, such as salmon and sardines. Add almonds, avocados, and dark leafy greens to your diet to naturally hydrate your skin and support nerve conduction. If necessary, consult your doctor about taking omega-3 or vitamin E supplements. Remember, your hands and wrists are the extended arms of your life. They help you hold, care, write, and connect with the world. So when you feel that itch, don't just apply a cream and forget it. Pause, listen, and care for them with the appreciation they truly deserve. When the body sends subtle signals, like an itch in the lower back or hips, many people assume it's just due to sweat, friction from clothing, or seasonal dry skin. But for older adults, this area often hides silent warning signs of more serious health issues that should not be ignored. Have you ever felt a dull, persistent itch in your lower back, even when you're not sweating or wearing tight clothing? Or perhaps the itching is accompanied by stiffness or discomfort when standing for long periods or bending over. If that sounds familiar, it's time to pay closer attention to this vital region of the body. The lower back and hips are home to large nerve pathways and muscle groups that support walking, standing, and sitting. Persistent itching in this area can be an early sign of neurological conditions such as sciatica or spinal stenosis, issues commonly seen in older adults as the spine naturally ages. Nerve compression not only causes pain and numbness, but can also lead to a deep internal itch that topical creams can't relieve. Another common culprit is kidney dysfunction, a condition older adults are more susceptible to due to diabetes, high blood pressure, or long-term medication use. Kidney problems can cause a buildup of waste products in the blood, which often results in widespread itching, particularly in the lower back. This area is also prone to skin conditions like eczema, psoriasis, or fungal infections due to frequent friction and inadequate moisturization. These conditions can cause intense itching along with darkened, flaky, or scaly skin if left untreated. The good news is that you can manage and improve these symptoms if you learn to listen to your body and take early action. Itching should never be dismissed as just a small thing. It's often your body's way of asking for deeper care. First, if you experience persistent itching in your lower back or hips, consult your doctor for a kidney function check. This includes blood tests, urine analysis, and ultrasound scans. These tests are crucial for catching kidney issues early, especially in those without obvious symptoms. At the same time, imaging tests like MRI or CT scans of the lumbar spine can help identify spinal stenosis or disc herniation, which may be causing nerve-related itching, pain, or muscle weakness. To support your lower back health, maintain good daily habits. Avoid sitting in one position for too long, lift objects properly, and sleep on a mattress that supports your spine without adding pressure. Gentle stretching, swimming, or therapeutic yoga can increase flexibility and reduce muscle tension in this region. As for skincare, make sure to thoroughly clean your lower back, especially if you sweat often or wear tight clothing. Moisturize regularly using creams with ceramides, and apply mild anti-inflammatory ointments if recommended by a dermatologist. If itching is accompanied by redness or flaking, fungal tests or skin biopsies might be needed for accurate diagnosis and treatment. Itching in the lower back isn't just a surface-level problem. It may be the voice of your nerves, kidneys, or skin asking for care. Paying attention to this often overlooked part of your body can make a significant difference in your overall health and daily quality of life. And when you choose to listen to these small signals, you're also learning to love your body in the deepest, most sustainable way possible. Thank you for taking the time to join me on this journey of uncovering the hidden risks behind seemingly minor itches in older adults. Your attention today isn't just a gesture of self-care. It's an act of love toward your loved ones who are walking this path of aging alongside you. Together, we explored 5 key areas of the body, from the legs, neck, upper torso, and hands to the lower back, and came to understand that every itch may carry a deeper message from within. It's not always just dry skin, allergies, or the weather. Sometimes it's an early sign of diabetes, cardiovascular disease, spinal degeneration, nerve damage, or even kidney failure. What truly matters is this: the sooner you listen, the better your chance to care for your health. What did you take away from today's content? Was there a part of your body you once overlooked, but now realize needs more care? I invite you to share your thoughts or questions in the comments. Your experiences might just help someone else. I believe this wholeheartedly. No matter your age or where you live, you can always begin caring for your body again, starting with the smallest steps. Whether it's moisturizing your feet, scheduling a checkup, or simply pausing to listen to what your body's telling you, each act is a step in the right direction. It's never too late to start living better, and you're never alone on this journey. If you found this content helpful, please don't forget to hit like, share it with your loved ones, and subscribe so you won't miss upcoming videos. We'll continue walking together through meaningful topics on health, peace, and happiness in later life.